Thanks everyone for coming today. My name is Kim McKechnie. I'm the Executive Director of Communications and Community Engagement for the Saskatchewan Health Authority. I'm going to be moderating this, and so I just would like to say a few comments first to set the context. The information we provide today will include the number of patients we are caring for in hospital related to the Humboldt Broncos accident and their general condition. We will also provide you with information about the health system response and try to give you a better sense of what that first night of trauma response looked like. We will not be answering questions regarding names of patients, specific injuries, or specific care. We will also not be answering questions about the misidentification. Those questions should be directed to the Ministry of Justice. Today we'll begin with a statement from Saskatchewan Health Authority CEO Scott Livingston, who's the furthest to the left here. And then that will be followed by remarks from Physician Executive Mark Wahba, who's a Physician Executive on the executive team for the Saskatchewan Health Authority. And then after Mark is done, we'll take your questions. So with that, I'll hand it off to our CEO, Scott Livingston.
Thanks, Kim. Thanks, everyone. So like all people in Saskatchewan, all of us at the Saskatchewan Health Authority have been devastated by this tragic accident involving the Humboldt Bronco Junior A hockey team. Healthcare providers and support personnel have been working tirelessly to care for patients and families to ensure that they have what they need both physically and emotionally. Our hearts are with the patients and their families and those with enduring injury and loss. A tragedy like this requires not only healing of the body, but healing of the mind. Our mental health professionals have been working with those affected on the ground in Humboldt and also supporting that community. As well, we've deployed them to support both our providers and first responders. I want to thank the people of Saskatchewan for the outpouring of support that they've shown patients and families, but also for healthcare providers and support personnel. There's simply not enough words to say thank you. In particular, I want to acknowledge the employees and physicians who have put their needs ahead, who have put the needs of many ahead of their own and have rallied together to do everything humanly possible to care for the Humboldt Broncos and their families. We have truly responded as a provincial healthcare system. From our first responders to our staff, physicians, and throughout our communities and healthcare facilities. Caring for and supporting all of our patients and our families within our facilities and throughout our communities is our #1 priority. And it's one of the reasons why I'm asking today, right now, what is needed most on behalf of our patients and families is time and space for them to heal. We're asking that the media not come to our hospitals unless we ask you to. Patients and families need privacy, and they need to feel comfortable that they're being in or around the hospital without being photographed or questioned. I'm also asking today that the media not contact our staff and physicians. They're actively involved in patient care, and this must remain their priority. We know Saskatchewan people are eager to hear the progress and updates on our patients and families, and we will do what we can to provide you the information that families are comfortable with us providing you today. I know that there's also a great interest in the province and around the world at and how our system responded to this tragedy. I can tell you that the health system and its partners were at its absolute finest in the most of horrific circumstances. Today you're going to hear from Mark Wahba, one of our physicians, who's going to provide some information around our patients and our families and the response to this tragedy.
So we'll toss it to Mark.
Good afternoon. First of all, Can you spell your name? My name? Yeah. W-A-H-B-A. And it's Mark with a K. First of all, I want to offer my condolences to the families and friends of all those who lost their lives or were injured as a result of this tragic incident. I also want to express my solidarity with the Humboldt Broncos, the City of Humboldt, and everyone in Saskatchewan and nationwide impacted by this tragedy. With the permission of the patients and families, we want Saskatchewan people to know that as of today, 12 patients remain in hospital. 4 patients are in critical condition, 4 patients are in serious condition, and 4 patients are in stable condition. Critical condition means life-threatening injuries. Serious condition means significant injuries. When we first learned of this terrible tragedy, we initiated a system response called the Code Orange. This process starts mobilizing resources and creating capacity within the system to respond to many critically ill patients arriving at the same time. I want to sum up our experience by quoting my friend and colleague, Dr. John Witt, who was a physician on staff at the Incident Command Center that evening. As one of the staff at the Incident Command Center at Royal University Hospital, I witnessed our entire Saskatchewan Health Authority team working together in a collaborative effort despite the scope and emotional impact of this tragedy. The community response at the scene and local hospitals was truly amazing. The rapid response and support from the surrounding communities and wider province and provinces, including ambulances, helicopters, planes, staff, and supplies, undoubtedly saved many lives. The support from hospitals province-wide, absorbing the additional other acute care needs, allowed us to devote our resources to helping the injured victims as they arrived in Saskatoon. The response from the staff in Saskatoon at all hospitals was humbling. Staff on all units and all departments at all levels went above and beyond supporting the patient care effort and families of the victims. I can attest as a physician who was on scene with STARS. It was truly a team effort. It was a province-wide team effort. Again, I want to say that my heart is with the patients and families affected by this tragedy. My heart is with my colleagues, physicians, nurses, paramedics, support and administrative staff, the volunteers, all the healthcare providers who are working so hard to attend to those who are suffering. Thank you.
So with that, we'll take questions. For those on teleconference, we're going to start with questions in the room, and once we've exhausted those questions in the room, we will invite you to ask questions via teleconference. So with that, thank you. I'll ask who has the first question.
I'll go first. Mark,
Please.
sounds like you were on the scene.
Yes.
Can you describe your experience, what you saw?
Let me correct that. I was not on the scene. I went to Nipawin Hospital.
Can you describe that?
We were the 3rd helicopter to arrive in Nipawin, and it was very calm when we arrived. I can't say enough about the team in Nipawin, the EMS, the first responders, all volunteers, the community support, the physicians and nurses, that they had everything completely under control. Scene commander was Dr. Van de Kamp from STARS. She was organizing and coordinating transport out of Saskatoon. So when I arrived, they had everything in control.
Do we have another question? And if you could just maybe your name and where your outlet before you ask a question, please.
Karen Paul, CBC National News. We've heard a little bit about the chaos and the difficulty in figuring out what was going on in the scene. How were patients triaged and moved into different facilities? Who's making those decisions and on what basis?
Those decisions would be made at the scene by the responding EMS team, who are trained in mass casualty triage to determine who is the most sick and where are the best resources that they can go to. So that would be made at the scene.
And how, I mean, can you describe it all from hearing from your colleagues, the chaos there? We were hearing people were lying on the pavement waiting for first response.
Truthfully, I don't know. I haven't talked to anybody about that aspect.
long was it until first response arrived?
I don't know that answer.
We can follow up with those exact details for media in a bit of a timeline, so that can be followed up with
Yeah,
that.
timeline would be great, just,
Yep.
first 911 call.
Yep.
What happened? You said you were the third helicopter, and the first two were in the scene?
First two went, yeah, I think one went to the scene and then they both went to Nipawin because the patients had been transported to Nipawin
By,
by ground.
Ground ambulance.
and where did those ambulances come from? How many did you have?
Again, I don't know the
Yeah,
fine details.
I don't think those exact details, I think we can follow up with all those exact details on that, yeah.
What about the casualties related to?
Sorry, if you can speak up.
Do you know where the casualties were taken?
Oh,
Like the ones who didn't make it, who didn't need to go to the hospital?
No, I do not know.
yeah, no, well, the casualties went to various different sites, but ultimately all ended up in Saskatoon.
What about CTV news? You said that when you arrived in Nipawin, it was quite calm. When did it turn to chaos for you?
This isn't about me. This is about the care providers, the families, the patients. I never saw it turn to chaos. When I came to RUH, it was in control. When I arrived in Nipawin, it was in control.
How are you feeling today?
Not very good.
Nick with City TV. Mark, obviously there's two sides to this, but one thing I've seen from an outsider is just the sense of community, Saskatchewan, and the world just coming together. Talk a little bit about that, seeing your colleagues working, and just, it's such a tragedy though, but to see that perseverance going through, if you can kind of just talk about that side as well.
Yeah, Scott and I were talking about this earlier today. I think the biggest thing that's amazed me from this tragedy is exactly that, this sense of community and how everyone just dropped everything and came together and played their role. And everybody knew what their role was, and everybody did their role, and that's why the system response worked in the way that it did.
And I'd just like to add, I think, to Mark's point, one of the other things that happened is beyond the SHA resources, the Saskatchewan Health Authority resources, partners across the province, the community of Humboldt, the hockey community, other government organizations and community-based organizations, first responders were critical to this response and ongoing response, supporting families and the communities through this tragedy.
How are the first responders, what are they doing to deal with the trauma that they've seen prior?
Do you want to answer that? Do you want me to?
Maybe start with Scott.
So I won't speak to specifically how all of the first responders are doing, but in part of our process in working through a tragedy and a mass casualty like this is providing follow-up care for all providers and debriefing them.
Stroke alert, emergency department. Stroke alert, emergency department. Attention please, stroke alert, emergency department.
So we've already finished a number of debriefings with first responders, and for all staff involved there are resources available both through employee support but other supports to ensure that we don't leave the providers out of it. So the same type of resources we're providing to the communities and in the schools in Humboldt and area to support those kids that will be going back into school and would have lost a friend or a loved one are all part of a organized approach to be able to follow up on recovery post this event.
Any more questions? Could you speak up a little bit?
Yeah, I'm just trying to understand what's exactly more, you said it before, more information, what's the difference between critical condition and serious condition? Can you be more complete?
Nothing more than what I've told you. Critical condition means life-threatening injuries. Serious condition means significant injuries.
Okay, can I take another, we have another question?
Can I just ask one more? Frank Cervalli from TSN. I know you guys deal with emergencies and trauma on a daily basis as part of your job, but could you just kind of share with us what these last 3 days have been like for your team, and just nothing, I'm assuming you haven't seen anything like this before, but what this has been like to try and get through it yourself.
Maybe Scott.
Yeah, sure. So I think to your point, I mean, we have not seen a mass casualty of this nature in the province. In my 30 years of working in healthcare, it is one of the most significant events ever. And with respect to how the system responded, I mean, one of the things, you know, that I think we're proud of is the system worked exactly how it was supposed to work, and people were cared for exactly how they should be cared for, and we're trying to do whatever we can to make sure that we continue to support those folks, because we know beyond the event itself, this has changed the lives of hundreds of people in our communities across this province and outside the province, and it's not something that's going to be done today or tomorrow, and it's how we plan through it in that recovery phase. But it's unprecedented in our province's history.
Do I have another, sorry, Nick, I think we need to give, yeah, sorry, we had, does anybody else have a question before I let Nick have one? Go ahead.
Trevor Howell from Star Metro Calgary. I'm curious about maybe provide us with some idea. I mean, there's a lot of talk about what's being provided to first responders now. What kind of training do they get beforehand? It's my understanding, like the training that they get in the to help with trauma events such as this differs based on the level the paramedics are at. Differs from what STARS, for example, gets. I mean, can you speak to that? I mean, because how you react to an event before, you know.
I'm not sure I understand the question, truthfully.
What kind of training do first responders get so that they are prepared for traumatic events like this? I mean, it's one thing to provide help afterwards, but what do they get beforehand?
So I think, truthfully, it's the training they received to respond to these types of emergency, which is hopefully preparing them. But there is no training that would help a human being to prepare themselves for a tragedy of this nature. And it's why you have to focus on that debriefing and those conversations and crisis trauma and social supports after the event occurs. I'm not sure we could do anything to prepare a human being for what has happened in this province on Friday night. It's why it's so important to follow up on a long-term basis. If we've learned anything from the tragedy of the past in 1986, the Swift Current Broncos, is the system has changed a lot since then, and we know a lot more about how to manage these things and how broad the impacts can be across people that were indirectly impacted by this, not just those folks directly impacted by it.
So I'm going to go back to Nick. You had one more follow-up.
If you guys, and I know we want to respect, obviously, the families in the next few days here. Mark, could you help us out maybe kind of painting a picture what the next few days are going to be like for you and Scott, for your whole, the whole team here? Obviously caring for these patients, and I mean, maybe, because I know some of these kids aren't home yet, because some are from different provinces. Is there anything you can speak about in the next few days here?
Do you want to start, or do you want?
Well, with system-wide stuff.
So I'll start with, you know, again, and I mentioned this. The response to this goes well beyond the doors and facilities of the Saskatchewan Health Authority. So we have coordinated a provincial response with virtually every provincial organization you can imagine in the province, whether it's highways or corrections or social services, at the elementary school, the advanced education system, because some of these kids are in high school, some of these kids are in university. So to be able to actually create a province-wide approach to this emergency and this mass casualty has been something that has been brought together both by the healthcare system but by the province at whole. And that doesn't stop today, because we now have, you know, people in the hospital. That continues, and we have been meeting on a regular basis daily, both internally as a team, huddling on what's going on the wards and with our patients and our families, following up with those first responders or anybody else who's actually been caring for these patients, but then taking that out in a cascading manner, both to the community of Humboldt as well as surrounding areas. As I said, we're partnering with the school divisions to ensure that the kids, when they get back to school tomorrow in Humboldt, are properly cared for with respect to having the right people on the ground, so they have somebody to talk to about this tragedy. And that's really what we're going to continue to see over the next little while. With respect to getting kids home or bringing families here. We've got supports in to support the families when they're here from both accommodation, and we've got phone numbers. We've issued numbers publicly for people in the public that may feel that they need that came up upon the accident that needs some kind of counseling. So we've actually spread those numbers out, and we will continue to do that until the need isn't there. And that's going to be a long time. It's not just the next couple of days. I suspect we'll be dealing with some of these things for a while.
So I've got one last question in the room before we move to teleconference. So
Yeah, and I apologize, but I'm just trying to understand this a little bit. So I know it's a provincial issue, the misidentification, but as a medical staff, how is it possible not to know who you're dealing with, who you've got blood types, and identifying things for an individual? Like, I just don't understand.
we indicated that we can't speak to that. That's a issue. If you want to speak to the Ministry of Justice and refer your request to them, please do.
But I guess you and your staff are hands-on. You're right here. You know who you're dealing with. The Ministry of Justice doesn't.
I appreciate that, and there's a follow-up process for that, and the Ministry of Justice can speak to that. So I'm going to ask for questions on teleconference.
Hi.
Yes.
It's Rob Drinkwater with the Canadian Press. Look, I know you're directing this to the Minister of Justice, but I mean, the hospital has some involvement here. I mean, Xavier LaBelle was being cared for when the hospital would have thought he was Parker Tobin or perhaps someone else. Was Parker Tobin's family at LaBelle's bedside thinking it was their son?
We aren't going to comment on anything related to patient matters. We don't have the consent to do.
All right,
we don't
well,
have consent to do that.
I mean, this must be very distressing for other families. Are other grieving families wondering if there was a mix-up similar in their cases and thinking that perhaps their son's alive?
Yeah, I think the same thing. I mean, we can't get into this without the consent of the families involved to speak about this and anything related specifically to them. That's just not something we can do without being consistent with our privacy restrictions. So
well, this isn't a specific name I'm asking about. I'm asking, you know, are other families perhaps calling in, wondering was there a mistake in our case?
I'm just going to refer you to the follow-up process with the Ministry of Justice. I just don't think we have indicated that is a matter that they will speak to, and they will speak to alone. So please ask for other questions from the teleconference line.
Can you speak to what triggers a code orange? Who takes charge and who gets called in?
So I'll ask Dr. Wahba to speak to that.
So a code orange happens when we have an incident where the number of patients, it's a large number of patients arriving all at the same time. And what happens is as I mentioned, we initiate a system response. We mobilize resources to create capacity. So we get extra operating room staff. We call in more physicians. We call in more nursing staff, support staff. We move patients within the hospital to prepare because the new patients are going to arrive at close to or at the same time. So there's a coordinated team that is called in and sets up an operational command center and a site director in the emergency department that directs as the patients come in, gives each patient to a specific team.
And how often I guess when was the last time there was a code orange in the province?
Do you?
It's a good question, Pam. We'll look into it, but I'm not aware of one recently.
It's pretty unprecedented. Can I get, we'll follow up with that, Pam. Is there any other questions from the teleconference line?
And so this coordinated team
Can you please, we just need to know, I apologize, I didn't introduce, can you just say your name and the media outlet you're representing?
Oh, sorry, it's Pam Cowan.
Sorry, Pam.
Yeah, it's okay. So I'm just wondering, so this coordinated team that gets called in, then that team coordinates the ground and air ambulance? Are they in charge of all of, the entire operation then?
Well, there's an operational command team, and so a member of that team would coordinate the ground and air ambulance in coordination with Link Center STARS in out of Calgary. So a member of that team would help coordinate that. But the actual staff in the emergency department would not be coordinating the ambulance response.
Can we make time for, are there any other questions on the teleconference? Well, with that, I'm just going to ask if our CEO has any final remarks before we conclude the teleconference.
No, I think what I would reiterate is, for those folks that are asking the questions, how did the system in Saskatchewan respond? And I truly believe it was a system-wide response to this tragedy. Is we saw the absolute very best of Saskatchewan in one of the absolute worst situations possible.
Thank you. Thank you for your coming today. We appreciate your patience, and thank you.
Can I just ask though, I know the response was amazing, and I know that you are supposed to take action, but there's been a very big mistake here, and mistakes like this don't happen very often. What have you learned from this? What are you do different?
Sorry, I think we already indicated that we wouldn't answer questions on that, and I think one of the things that is that there's a process behind all this, and it's led by Ministry of Justice. So I think we would ask you to pursue your questions through the Ministry of Justice. So thank you very much.